Hi everyone, this is Dr. Zhang. I'm here to answer another question, which is how far in advance should I plan my treatments in case I have a special event to go to? So for the three different types of treatment that we offer here at College Square Dental, which is mole excision or cosmetic injectables like Botox and fillers, each one has a different particular timeline in terms of what the final results will look like. For cosmetic mole excisions, typically we'll leave a suture in for about 7 days after the excision, and then that suture gets taken out by us at your 7-day follow-up. You're still going to have a faint red line in that area, but at that time you could cover that up with makeup or wear a band-aid if you choose to. I typically recommend that patients who get cosmetic mole excisions, especially for very aesthetic areas like the face, to wait if they have an immediate event coming up within the next 2 weeks, to wait until after that event is done before they come to have that mole excised, just because of the healing process afterwards. So for treatments like Botox and fillers, the full effects are typically seen at around 2 weeks. For Botox, most patients are able to see effects starting at around day 7, and full effects kick in at around day 14. For fillers, the effects are kind of immediate, but there is some swelling that takes place after the injection, and it takes about 2 weeks or so for the filler to fully integrate with the tissue. So the final results from the filler are mostly there by around 2 weeks or so. With regards to how long you should wait if you have an event coming up, say you have an event coming up within the next 2 weeks. In that circumstance, I typically recommend that you go to your event first and then come back and get the treatment after. The reason for that is for Botox treatments, everyone reacts to Botox a little bit differently. So this is why I always get patients to follow up with me about 14 days after their treatment in case they need a touch-up or we need to inject more to achieve the desired effect. The same applies for fillers as well. If you do have an event that is, a few more weeks down the road and you want to look your best, certainly if you don't have anything coming up within a 2 to 4 week period, you could certainly get your treatment first and then, have your best face for your event.